Hi, my name is Brendan Roberts. I'd like to speak with you today about chronic fatigue. Now, chronic fatigue can be a very challenging condition to treat because it falls through the cracks of Western medicine. Oftentimes people will present with normal thyroid, they'll present with normal iron levels and normal lymphocytes where it doesn't appear that there's infection, yet clearly they are chronically fatigued, where there's just not enough energy to really live life with vitality. So alternative medicine is a very, very good approach for that because we're looking at really other factors. We keep our eye on infection, allergy, and emotion. Now, I don't think I've ever seen a patient with chronic fatigue that is not eating food that they're allergic to. So there's a number of ways to test that. It can be tested with saliva, it can be tested with blood, it can be tested with a Vega instrument that I have that's like a biofeedback machine, depending upon a person's budget. But I have seen miracles with finding the food allergen, taking a person off of it, and seeing that all of a sudden their energy comes up. Because one of the symptoms of food allergy or food sensitivity, you might not even show in the blood as an allergy. One of the symptoms of that is fatigue. That's one of the ways our body tells us that we're kind of poisoning it. So number one is look at the diet. And number two is infection. Now it's not uncommon for people to have some degree of parasitic infection, bacterial infection, fungal infection in their gut. And fungal infection in the gut, bacterial parasitic infection in the gut, basically what that does is it produces malabsorption. And it produces a chronic state of inflammation. When the gut is chronically inflamed, then the adrenal glands have to secrete cortisol, and when the adrenal glands become fatigued from always secreting cortisol to bring inflammation out of the gut, then what happens is that not only do you have the digestive issue, but then you have a hormonal issue with deficient cortisol. And to have energy, you need to have sufficient cortisol. Now, emotions can be a factor also. So there are ways that I can test with kinesiology to see if there are particular emotions that are really being kind of locked in the body, suppressed in the body, that are then going to affect a person's overall physiology. In cases like that, there's some very quick clearing techniques that we can do, or when appropriate, I really recommend that people have counseling. The other factor that I look at with chronic fatigue is structure. Now, you wouldn't think of this right off the top of your head because the person might not have pain, but if the cranial bones, if the upper cervicals, if there's torsion in the vertebrae, it's going to affect normal neurologic function. So I keep an eye on the structure, food allergies, infection, emotion, inflammation, and of course deficiency. Because if one is deficient of essential fatty acids, minerals, vitamins, protein, the body just does not have the proper building blocks to function. So these are the things that we look at. Chronic fatigue is really not a disease. It's more of, can we see where the body is not regulating, look at these factors and bring it into regulation.